ophthalmologist. So, after yun, knowing that you have diabetic retinopathy, so first of all, we should always remember to control our glucose level. So, what is the normal glucose? I will just ask if you know what is the normal glucose level. So that from there, I will teach you how to control. So what is the normal glucose level? You came here last week and I already told you the normal blood glucose level. So what is the normal blood glucose level?
I do believe that the 120.
So, are you sure?
120. Hindi ko nga lang, pasyente ako.
So, what criteria are you using? So 120. So when did you had your glucose check?
Yesterday. What's glucose anyway?
Glucose is simple sugar.
C6H12O6.
No, in our foods. So 120. So Bong, your glucose is. So what's your baseline glucose, by the way?
What's my baseline?
No, 120 is. Are you sure it's the normal?
Yes.
So what's your baseline glucose?
120.
So you're on the border.
I'm normal.
You're normal, but you're on the higher border. Higher normal border. So what you must do?
Higher border. Andun yung 3 words.
What you must do is just regularly check your glucose level to see to it that it will not go beyond the normal. And then please limit your, what is your dietary intake? Usual intake.
What's your favorite?
Mixed vegetables and protein.
Oh, you're very healthy. You must be healthy. So, it's good you're eating proteins, and I think you should also eat your rice. Are you eating rice? Or bread?
Yes.
So if you're eating bread, I think it's better if you choose wheat bread because it has lower glucose content. It has a lower glycemic index. So, and then if you're eating a lot of vegetables, you must also refrain from eating carrots because it has a high glycemic index. Also, banana. It's written in our medical nutrition book.
May book siya.
I read it at the library. So, aside from that, you must refrain from eating.
Sama na tayo.
I want decision between the patient and doctor. Siya ang doktor mo.
Ako kasi. Puro bakla na kainis.
Kailangan na sabihin.
I'm not if I'm the patient, and first, if I'm the doctor,
Ano ba talaga?
I will not go to this.
Then go!
Because yun.
Yung forbids banana.
I think as a doctor, we must advise aside from getting a good history, we must also advise the patient on how to modify their lifestyle. Because as doctors, we're not only treating the disease but also the person. So for this, for the skit that they made, all I can say is that the doctor should have instructed the patient also to have a screening test aside from modifying her diet. Diet pala. And also to advise other family members of the patient to undergo screening tests also, because they also have a high risk of having diabetes mellitus and eventually developing diabetic retinopathy. That could make a lot of time.
As a patient, it is a terrible experience. Because at first, aside from the anxiety you feel as a patient because you're uncertain of your health. Opo. Aside from the anxiety that you feel about the uncertainty of your health, you're being parang interrogated about the normal virus, which the hell you know about. So I think it's a wrong approach. So.
Okay lang yan.
Doctor, Arvin, how do you assess yourself?
Assess yourself! In English.
As a doctor, I think
Hindi daw scenario na ito.
I need first I need to communicate at the level of the patient. Maybe he doesn't understand me. So siguro nagkakaroon ako kasi and then yes, it's not proper to ask the normal values because you're not a medical student. You're my patient, so I don't know what's your background. And then also I didn't had a good interview with my patient, so I just advised him immediately. So what is better to do is to have a good interview, complete physical exam, then diagnose properly and advise properly.
Ophthalmologist. No, nag-heart sounds. DRA, nag-DRA.
Okay. Any question about
About the